Everybody's ready? The phrase throwing money at a problem has been saddled with a lot of negative connotations over the years, but sometimes money is exactly what's needed to save lives. I'm here today with some of Kentucky's top medical professionals to make an announcement that illustrates just that point. I'm excited to announce that Kentucky will receive almost $2.6 million in federal grant funding over 5 years to help us continue our aggressive efforts to reduce colon cancer. The money will be used to increase screenings and improve health outcomes with a focus on underserved populations in Louisville and Appalachia. This grant, quite simply, will save lives. We all know about cancer in Kentucky. Whether you look at the numbers or tell the story through the pain of families dealing with this disease, Kentucky's cancer narrative is filled with suffering and hardship. Our state has long had the dubious distinction of being among the nation's leaders in cancer incidence rates and mortality rates, also known as diagnoses and death. In fact, almost 9,500 Kentuckians a year die from cancer. That is a lot of suffering. As a part of our Kentucky Health Now initiative, chaired by Lieutenant Governor Crit Llewellyn, we're trying to reduce those numbers by increasing screening rates for colon, lung, and breast cancer. Screening is particularly effective for colorectal cancer because it's highly preventable with early detection and removal of precancerous growths. The Federal Centers for Disease Control and Prevention says that the 5-year survival rate for colon cancer is 90% when it's found and treated early. So we've taken a lot of steps to increase our screening rates. The biggest step has been our embrace of federal health care reform, through which we've helped more than 500,000 Kentuckians gain health insurance and better access to care. Between 2013 and 2014 alone, we have more than doubled the number of Medicaid patients receiving colon cancer screenings. Earlier this year, I also signed legislation that requires health benefits plans to provide complete coverage for colorectal cancer screenings. By coding colonoscopies as preventive care instead of diagnostic care, patients are not charged for that procedure. But if you don't have insurance, screenings can be difficult to obtain. To fill that gap, in 2012, we announced a partnership with the nonprofit Kentucky Cancer Foundation to offer screenings for various cancers to low-income and uninsured Kentuckians, especially the elderly. The foundation matched a $1 million allocation I put in the state's budget for colon cancer screenings, and I repeated that allocation in 2014. Those screenings, by the way, brought to light not only numerous cases of precancerous growths, which were then removed, but also several cases of undetected colon cancer, which was then treated. Folks, that's real people and real lives. The foundation is also participating in a separate campaign, which the First Lady will talk about in just a minute, to fund a mobile screening unit. This new grant complements those efforts. It will be coordinated by the Chronic Disease Prevention and Control Branch of the State Department for Public Health. As I said earlier, it will focus on improving screening rates and outcomes, both in terms of incidence and mortality rates in Louisville and Appalachia, because those regions have large numbers of underserved, underscreened residents. The effort will bring together 16 partners across a number of healthcare settings, including universities, advocacy groups, nonprofits, and state government. The Kentucky Health Now initiative set a goal of reducing cancer deaths in Kentucky by 10% by 2019. We believe that this grant will help us to achieve that goal. Cancer is a horrible enemy. I know, I'm a cancer survivor myself, but there is hope and we are not helpless. The fact that we have so many people and agencies committed to fighting this disease is our greatest asset. If we work together and aggressively take steps like we're announcing today, we can significantly lessen the suffering of our people and improve the long-term health of the Commonwealth of Kentucky. Let me now call upon Dr. Tom Tucker, Associate Director of Cancer Control and Senior Director for Cancer Surveillance at the UK Markey Center. Dr. Tucker.
Thank you, Governor. Colorectal cancer is one of the most common cancers occurring among both men and women. More than 2,600 new cases of colorectal cancer are expected among Kentucky residents in this year alone, but many of these cancers can be prevented. Colorectal cancer screening can find polyps at an early stage, which can be removed before they ever become cancer, and screening can also prevent deaths by finding the disease at an early stage when our treatments are most effective. In 2001, Kentucky had the highest colorectal cancer incidence rate in the country, and the screening rate for colorectal cancer was second to the lowest, with just over 1/3 of the age-eligible population, those age 50 or over, having ever been screened. To address this problem, the Kentucky Cancer Consortium began an initiative in 2002 that ultimately brought together more than 60 different agencies and organizations, including the Kentucky Department for Public Health with its outstanding leadership, the American Cancer Society with its strong public policy advocacy program, the Colon Cancer Prevention Project led by Dr. Whitney Jones, the Kentucky Cancer Program with its community-based cancer coalitions, and the Kentucky Cancer Registry, which provided the data essential for understanding the colorectal cancer burden in the state and for measuring the impact of our interventions. Working together, these organizations have had a profound impact on the colorectal cancer burden in the Commonwealth. In just 7 years following the implementation of this collaborative effort, the colorectal cancer screening rate in Kentucky went up from 1/3 of the eligible population having ever been screened to nearly 2/3. This moved Kentucky from 49th to 23rd in colorectal cancer screening. No other U.S. state had such a dramatic increase in screening in such a short period of time. With the rapid increase in screening came a 24% decrease in the incidence of colorectal cancer, and deaths from the disease decreased by 28%. Let me put this in perspective. This means that every year, 230 Kentuckians who would have been diagnosed with colon cancer no longer get the disease. And nearly 170 fewer Kentuckians die of the disease each year. This is a remarkable public health accomplishment, but we're clearly not done. Our screening rates are no longer rising rapidly, and 1/3 of the eligible population has not been screened. Getting the remaining third of eligible Kentucky residents screened for colorectal cancer will be challenging. In general, this population has fewer financial resources, less education, and until recently, many in this population have not had access to health insurance. While all Kentucky residents age 50 and over who have not been screened are at risk, the most vulnerable at-risk groups are those living in the Appalachian area of the state and African Americans, both males and females. The new grant, just announced by the governor, will be an essential resource in helping us reach this last third of the eligible Kentucky population with life-saving colorectal cancer screening. Thank you.
And next, a person who has been a champion in this area for years and has worked tirelessly to get us where we are today, Dr. Whitney Jones.
Am I going to get a pension too? Like all you guys?
Maybe.
Thank you very much. Many times people feel like this grants like this CDC award to the Kentucky Department of Health come out of nowhere. In actuality, the infrastructure and collaboration has been going on for many, many years in the state of Kentucky. I'd like to recognize several key groups for taking part in this grant and finish by addressing the critical role that this grant will play in the work of our existing state program. First, the leadership, staff, and membership of the Kentucky Cancer Consortium. I'd say almost 5 or 6 years ago, we didn't even know we had a consortium. But look at all the great work they've done, and particularly led by Dr. Jennifer Redmond and Katie Beachy. The huge membership, over 60 groups of the colorectal cancer subcommittee, of which the Colon Cancer Prevention Project and the Kentucky Cancer Foundation participate, has played the lead role in bringing all interested parties to the table to provide a first-class grant proposal. For a decade, the consortium has supported the opportunity and the structure for diverse groups with a single goal in mind: increasing cancer prevention and early detection in the Commonwealth. Secondly, I'd like to recognize the Kentucky Department of Public Health, including Commissioner Stephanie Mayfield Gibson, who we've known for 2 decades now, Connie White, a great physician, and Sue Thomas Cox. I also want to acknowledge Dr. John Langfield, who is the Chief Medical Officer for the Medicaid Services, whose office will play a critical role in through our managed Medicaid organizations. These public servants have been tireless in promoting success in many areas of cancer prevention, including support for this grant. However, even with the great team described above, it was likely this grant might have been beyond our reach. And to be clear, we had failed at several prior CDC grants. What was missing in the past? It was, in fact, the Commonwealth's multi-year track record of governmental engagement, financial support that unequivocally placed us at the head of the government of this line in the federal state. I want to recognize the ongoing, overwhelming bipartisan support of the Commonwealth's General Assembly, both the House and the Senate. And I want to give a special thank you to our executive branch, who I'm going to coin for the first time our Cancer Prevention Administration. 2 of which are cancer survivors themselves, Governor Beshear and Lieutenant Governor Crit Llewellyn. And I also want to recognize Secretary Audrey Haynes for the generous and personal support on this project. And we would be remiss if we didn't recognize the work of the Kentucky Cancer Foundation and its board, who continue to raise funds for this unique private-public partnership, of which everybody around the country wants to understand how and why we did it, and for providing cancer prevention and early detection services for the uninsured. So that initial result of our last 6 years of governmental involvement, if you will, is that Kentucky has transformed into the state with the broadest number of colon cancer screening options, including cutting-edge fecal DNA technology, the lowest barriers for anyone to receive colorectal cancer screening in the nation. The result is, as Dr. Tucker said, we've had the most rapid rate in screening of any state in the nation, and we should be proud of that. But more importantly, we've begun to create the platform and the potential to not only improve screening rates further into the remaining third of folks, but also our screening reach, so that those people who've never felt like they've been part of this process can attain the goals that we've set for them, and hopefully we'll be one of the first southern states, if not the first state, to screen 80% of our population by 2018. The Kentucky Colon Cancer Screening Program and its advisory board have a statewide mandate to increase colon cancer screening for all eligible Kentuckians. A priority of the advisory committee is to increase colon cancer screening amongst the eligible Medicaid population, many, if not most, who are receiving their care in community health centers or public health departments. As of this date, we are already months into a nation-leading systems change program to increase colon cancer screening delivered inside community health centers and clinics statewide, partnered with the Kentucky Cancer Program, my good friends from the East and the West, the American Cancer Society, and the Colon Cancer Prevention Project. These new CDC funds will be used to increase our informatics capacity and connectivity with the clients of Medicaid managed care organizations to amplify colon cancer prevention and early detection amongst the underserved. Adding this strategic piece to the ongoing statewide programs that we have will be a game changer if we're successful. I'd like to finish by assuring everyone that our team will put this generous grant to work, saving lives and saving money. Today is another step forward to move Kentucky from worst to first in cancer prevention and early detection. Thank you.
And next, let's hear from Lieutenant Governor Crit Llewellyn.
Thank you, Dr. Jones and Dr. Tucker, for your tireless work to lessen the grip that cancer has on so many Kentucky families. And thank you, Governor, for your vision in not only embracing health care reform, but for your continued focus on healthy strategies and wellness initiatives to ensure that all Kentuckians can lead healthier, more productive lives. I first came to see the governor about this original $1 million allocation to the Kentucky Cancer Foundation long before I was lieutenant governor, because this has been something that's been very close to my heart. As a colon cancer survivor, I believe profoundly that all of us in public service shouldn't be able to sleep at night as long as we still have the highest mortality rate for cancer in America. And And I think all of us can take heart from these wonderful statistics that show the dramatic increases we've seen in colon cancer screening. I am cancer-free today because of early screening and detection. In fact, we now know that colon cancer is the one cancer we can prevent through early screening and detection, and if it is caught early, it can be treated effectively. Unfortunately, Kentucky has historically had some of the worst health statistics in the nation, including that highest mortality rate for cancer. And that's why I've been proud to partner with Governor Beshear and chair his Kentucky Health Now initiative, which tracks our progress in 7 critical areas impacting Kentuckians' health, from lack of insurance to smoking, obesity, dental decay, substance abuse, cardiovascular disease, and of course, cancer. But now, with Kentucky, a national leader in health care reform, we have reason to be optimistic. In just over a year, we've been able to move the needle in every one of these critical areas. More Kentuckians now have health insurance, dramatically more. We are covered, more Kentuckians are covered by a smoke-free policy. More can seek care for heart disease and cancer prevention and get dental services. And recent data shows the number of Kentuckians receiving screenings and preventive health services has risen dramatically, in many cases more than doubling since Medicaid expansion took effect in late 2013, indicating that our citizens are embracing the availability of these life-saving services. This grant announced today will go a long way toward reaching even more people and saving lives. Thank you to everyone who has participated in the successful grant. Thank you.
And now the First Lady of the Commonwealth, Jane Beshear.
Let me say I appreciate the opportunity to be a part of this announcement today and with this group that's up here, because I have a very personal stake in this. I have a mother that did not survive. It was a number of years ago, and the screenings were not available, and so she was not a survivor. She did not have the opportunity to take advantage of screening such as we have here. I'd also like to thank Madeline Abramson, who spent so much time during this second administration working with us, particularly in the colon cancer area, because she too was touched through her family with this disease in a very personal way. You know, you've heard so many of the statistics here, and it just makes us all realize the strides that have been achieved in the health for Kentuckians in the last few years. Between the numbers of Kentuckians that are now covered, we have a chance to really be a leader in this nation. I think we're doing a great job of raising awareness from the numbers of screenings that we're seeing taking place across the Commonwealth. We are a leader. I've had a chance to play a part in this whole effort with our Horses and Hope program. This is a breast cancer awareness, education, and screening program that actually brings treatment and referral to the place of work. This is something that we have found is extremely important. And working with our partner, the Kentucky Cancer Program, we took the mobile unit to the backside of the racetracks. We have taken it to farms. We have taken it to places where the people are working. These are at-risk population, and many of them have little or no access to health insurance and resources. I truly believe the way, Dr. Young, that we're going to complete this other percentage is to take these services to them, not wait for them to come to us. So with this, we partnered, again, with the Kentucky Cancer Program, with Kentucky One Health, and the James Graham Brown Cancer Center to raise $1 million for a mobile unit. This will serve the at-risk populations across the Commonwealth. This new van will be equipped to screen not only for breast cancer, but colon cancer and 5 other cancers. That staff will also provide preventive care, education, and access to local resources, such as the local health departments. By taking this van directly to the community at a location that is familiar and friendly, we hope that we can capture the citizens that need this service, those that are overwhelmed by trying to navigate the healthcare system on their own. Once we reach them, we have the opportunity to empower them through education and access to resources so that they can start to be responsible for their own health. I'm really excited about this initiative, and I look forward to announcing very soon a successful campaign. You know, there's not a single answer to all of Kentucky's healthcare woes. But as you see from this group here and from so many others that are working together, that if we work together, we can provide that access to services for our citizens. And we can educate, and educate the public about early detection and preventive care. So thank you for letting me join this. This is an exciting day for all Kentuckians and for the future of our Commonwealth. Thank you.
Okay, are there any questions on this announcement? Yes, sir.
Will this grant pay for screenings itself, or is it just like marketing toward getting people to get screened?
Who wants to answer?
The grant will, for those who are underserved and don't have insurance, which should be very few people now, it can be one factor that will assist us in helping to get payment for them. But one of the impetus of the goals is to help us have various levers like IT to leverage that continuum of care for diagnosis. This grant will work in collaboration with our current initiative that was in our biennial budget, the match between the state and the Kentucky Cancer Foundation, which is also reaching out to the uninsured. But certainly, this grant will target a population in the Appalachian region along with African Americans, because those are the two groups that are at most risk for not having screenings. Okay.
Anybody else?
Well, on that, what are the, I guess the governor or Dr. Mayfield, what are the biggest barriers for those groups as far as cancer screening go?
Well, we have pretty good information about perceived barriers for colorectal cancer screening based on the behavioral risk factor assessment trial. And the single greatest piece in Kentucky now is that people, they feel great. They don't have any family history. They don't feel like they need to be screened. Going to the doctor is not a common thing, particularly for a lot of men. The second reason has actually been that their physicians or health providers haven't recommended that. And again, I expect in our next round of BRFIS studies that percentage is going to go down in terms of that being a reason, because we have certainly been getting the word out. But essentially, barriers to prevention and screening are socioeconomic and educational barriers. So where we see those exist, that is where there is a barrier. So those are the most common ones, and we're trying to overcome those both by working with health systems and providers, but also public education, awareness, and such. So those are the main barriers in terms of the reasons.
Anyone else? Okay, thank you very much.